The United States of America has recorded its highest number of COVID-19 cases, reporting more than 45,000 new infections in 24 hours. The U.S. now has over 2.5 million COVID-19 cases. Health experts warned that it's just the beginning of the pandemic. This comes as several states emerge as new virus epicenters. However, President Donald Trump's administration continues to defend its handling of the pandemic. In fact, Vice President Mike Pence even said that the U.S. has flattened the curve. Remember, the U.S. has the highest COVID-19 death toll in the world.
Inarguably, as we see where we are today as a nation, because of what the American people have done, because of the incredible work of our healthcare workers, because of a partnership with governors in every state, we did just that. We slowed the spread. We flattened the curve. We saved lives.
However, top epidemiologist Dr. Anthony Fauci countered Vice President Mike Pence's claim, saying that the latest surge in infections poses a serious problem.
It's very clear from the maps that you saw that there are certain areas in the country, states, towns, cities, regions, that are doing very well, that have followed the guidelines and are opening up in a prudent way that's been effective. However, as you can see, we are facing a serious problem in certain areas.
The rise in COVID-19 cases has forced the state of California's governor to urge worst-hit counties to reinstate stay-at-home orders.
We are advising and counseling them to move forward and reinstitute the stay-at-home order, but they will move at their discretion. If they are not able to come to some consensus, I am committed to intervening, as is my role and responsibility as governor in the state of California. But I am confident in their capacity to make that determination for themselves based upon, again, the criteria of conditions that continue to persist in the county.
In other states like Texas, restrictions have been imposed, leaving businesses in the lurch. Several businesses who had invested in reopening are now bracing for more losses. Meanwhile, doctors have reported a disturbing trend of more young people falling ill to the virus. Authorities say that this is because youngsters are venturing out more as lockdown rules have been eased.
I think it's a reflection of a number of things going on. I think as we have opened up some of the restrictions and there's been more socializing, that typically tends to occur in younger populations. I think the seniors are staying home and probably being more cautious around that.
Meanwhile, residents flock to beaches in Florida despite the rise in the number of infections. The U.S. remains by far the worst affected country in the world due to COVID-19 as of now, and the number of cases is surging and the number of fatalities is growing by the day as well. And the youth is aiding in fueling the spread of the deadly virus. Across the U.S., people in their 20s, 30s and 40s are accounting for a growing proportion of the cases, amidst fears that asymptomatic young people are helping to fuel the virus's spread. In Arizona, nearly 50% of COVID-19 cases are between the ages of 20 to 44. In Florida, which breaks records for new cases nearly every day, the median age of people testing positive for COVID-19 has dropped to 35. In Texas, young people are accounting for a majority of new cases. And in Cameron County, people under the age of 40 are making up for more than half of the newly reported cases. The situation is alarming. Health officials are worried. Leaders are eager to open schools and universities. The youth is back at the restaurants and pubs, but amidst surging cases and the pattern of rise that puts the young people at maximum risk. Return to normal life and a fully functional economy now remains a distant dream. Even the Center for Disease Control and Prevention in the U.S. has acknowledged that the younger people have helped fuel the increase in COVID-19 infections. The new trend seems to be a departure from the early days of the pandemic. Gone are the days when infections in nursing homes were spiraling out of control and the virus appeared at higher rates among older people. For now, the youth is at a higher risk. In many cases, even if younger people do not show as many symptoms, they are still spreaders of the virus.